Hi guys, I've just completed a 2-day hair transplant procedure and I want to explain something important. A 2-day hair transplant is very different from 1-day procedure. It is almost like comparing a 5-day test match with a 1-day game. Both require skill, but the strategy, pacing, and planning are very different. With 1-day hair transplant, everything happens one continuous session. That means the team needs to extract, handle, and implant the graft safely within that day, while keeping the patient comfortable and protecting graft quality. But with a 2-day procedure, the planning becomes different. It is not simply about doing more hair. It requires careful strategy. We need to think about how many grafts or hairs can be safely extracted, how long the patient can comfortably tolerate the procedure, how the donor area will be protected, and how the grafts will be handled, stored, and implanted carefully throughout the procedure. For larger cases, especially when we are treating the front, mid-scalp, and sometimes the crown, trying to force everything into one very long day may not always be the safest or most appropriate option. In selected cases, splitting the procedure over 2 days can allow a more controlled approach, reduce patient and team fatigue, and help us make careful decisions for both the donor and recipient areas. But it still needs to be planned properly. The first day and the second day should never feel like two separate or random procedures. They need to connect as one overall treatment plan. For example, we need to think about which areas are prioritized first, how the hairline blends into the mid-scalp, how the crown is approached, how the donor area is managed, and how we avoid over-harvesting. Because in hair transplantation, the goal is not just to move as many hairs as possible. The goal should be or is to create result that looks natural, ages well, and protects the patient's donor area for the future. So if you're considering a large hair transplant, don't just ask how many grafts can I get. Also ask, is this safe for my donor area? Should this be done in a 1 day or over 2 days? And what is the long-term plan for my hair loss? Because a good hair transplant is not just about today's results. It is about making sure the result still looks natural in 5, 10, and even 20 years later.